Let's talk about buccal fat pads today. Dr. Ennis Plastic Surgery, Boca Raton, Florida. The buccal fat pad is an interesting structure. The thought is it helps us supple. It starts out way up here in the top part of the cheek. And over time, unfortunately, settles down here. It creates a lot of heaviness in the bottom part of the face. An older face tends to look very heavy and square. A young face tends to have more of a V shape or heart shape. So anytime we're trying to get the face to look younger, we want to get the point out of the bottom part of the face. Two ways we do that. One is by lifting the structure with something like a deep plane face up or a neck lift. Second way is take out the buccal fat pads. By taking out the buccal fat pads, which sit here just on the outside corners of the mouth, it significantly thins out the bottom part of the face. Now, do this in many of the face-ups we do. But we also do it in younger people if it's the right candidate. So a young person, puffy cheeks, full cheeks, chubby cheeks, yes, that does a great job of making the cheeks look thinner, taking out some of the fullness in the cheeks so you don't have the chubby cheek look. But there's a big misconception on the internet that makes you look gaunt or sickly. So if you already have thin cheeks, you typically don't want to take out the buccal fat pads because it's going to make them look too thin. You got fuller, chubby cheeks, great way to thin out the cheeks. Older face, the buccal fat pads already down here are serving no purpose. We need to get rid of it. All it's doing is adding weight to the bottom part of the face and making it look older. We want to thin out the bottom part of the face. One of the easiest ways to do is take out the buccal fat pads. About a 30-minute procedure, small incision on the inside of the cheeks. They slide out like a little butter bean. But again, and a lot of them, they're big. They're the size of ping pong balls in many people, but it really thins out the face. Recovery is pretty easy. Most people, their cheeks are a little puffy and swollen, a little bit like they had their wisdom teeth taken out. You're up and about the next day, typically out and about in 3 to 5 days. The sutures fall out, no sutures are removed, they all dissolve. Great way to thin out the cheeks, great way to thin out the bottom part of the face to get rid of that heavy square look. And they're done oftentimes in conjunction with a deep plane facelift. So, got the buccal fat pads, too low, take them out.